My name is Fred Hopkins, and this is the bone video for the appendicular skeleton. I'm going to start with the pectoral girdle. This is the clavicle, the acromial end, and sternal end. Next is the scapula, the coracoid process, the subscapular fossa, the glenoid cavity where the humerus attaches. Here we have the spine, the acromion, the supraspinous fossa, the infraspinous fossa, the sternoclavicular joint, the acromioclavicular joint. Next is the arm. This is the humerus, the head of the humerus, the greater tubercle, the lesser tubercle, the deltoid tuberosity, the medial epicondyle, the lateral epicondyle, the coronoid fossa, the capitulum, the trochlea is the point down here, and the olecranon fossa is this dent at the back. What goes in the olecranon fossa is the ulna here. What articulates with the capitulum and the trochleum is the ulna and the radius. Next is the forearm. We have the ulna, the olecranon, that's the elbow, the coronoid process, and the styloid process is the point. This is the radius, the head of the radius, the radial tuberosity, and the styloid process. Okay. Next is the carpus. We have the proximal row, the scaphoid, the lunate, the triquetral, and the pisiform. And there's the distal rows, the trapezium, trapezoid, capitate, and hamate. Which bones form the wrist joint with what forearm bone? It's the proximal row attaches to the radius. And which bone forms a joint at the pollex is the trapezium. And these are the metacarpals, and these are the phalanges. Next is the pelvic girdle. These are the coxal bones. We have the acetabulum, the pubic symphysis, the obturator foramen is the hole, the iliac crest is at the back, the anterior superior iliac spine, the iliac fossa. We have the greater sciatic notch, the ischial spine, and the ischial tuberosity. Next we have the femur. This is the head of the femur, the greater trochanter, lesser trochanter, the abductor trochanter, the medial and lateral epicondyle, the patella. This is the medial condyle and the lateral condyle. Next we have the tibia. This is the medial condyle, the lateral condyle, the tibia tuberosity, media malleolus. This is a proximal and distal tibiofibular joints. Next is the fibula. This is the head of the fibula. This is the lateral malleolus. Lastly, we have the tarsus, which is the foot. This is the talus. What bones does it articulate with? It superiorly articulates with the tibia and fibula. We have the calcaneus, which is the heel. We have the cuboid, navicular, medial and intermediate, lateral, cuneiform bones. These are the metatarsus and the phalanges and the hallux, which is the big toe. This concludes my report bone video on the appendicular skeleton.